All right, we're going to be talking through some of this because my camera decided to shut off halfway through and I've already torn open a lot of my equipment. So I'm going to verify my orders and I'm going to assess the current dressing, making sure it needs to be changed. It gets changed every 7 days or as needed for any other reason. I'm going to perform hand hygiene and then I'm going to identify my patient and I'm going to assemble my equipment nearby. I would have this all in the boxed up setting, but I've already torn up my alcohol and I want it to stay, keep from getting all over my stuff. So I'm going to make sure that I provide privacy and explain the procedure to the patient and ask for allergies to tape or any other antimicrobial or anything really. Place a waistband nearby and I'm going to help the patient into a comfortable position. If it's a PICC line, I'm going to make sure that their arm is below heart level. Since it's not a PICC line, I don't have to worry about that as much, but I'm going to still get them in a comfortable position and I'm going to provide a mask for the patient and myself. If the patient can't wear a mask for any reason, I'm just going to have them face away from the field. So then I'm going to get a sterile field set up. So I get all of my equipment, opened it up, sterile field, dumped it onto there, gloves ready. And then I am going to don clean gloves, which I have preemptively done. And I'm going to assess the site through the current bandage. I'm going to palpate to see if there's any tenderness, redness, swelling, pain. And there doesn't seem to be any. So next thing I'm going to do is I am going to gently pull off the dressing. And I'm going to do this from the edges first, all around. But then I'm going to make sure that I start pulling, when I pull it all the way off, towards the site of insertion, so as to not accidentally dislodge or pull the existing tubing out. Then if there were sutures or staples, I'd kind of check the status on them. And then I'm going to remove my gloves. I'm going to clean my hands again. And I'm going to don sterile gloves. Video camera crashed during the last video. I already applied them, and these are smalls. These aren't coming back off. So, applying sterile gloves to my hands, I am going to get my alcohol prepared. And I'd tear it open, and that would have been on my sterile field. I'm going to do this in a circular motion around the dressing. I'm not going to be touching the tubing with my hands because it isn't sterile either. I'm going to do this as far out as I can. Circular motions. Probably 2 to 3 inches out, but really we want it to cover the whole distance that our much easier when I have 2 hands, whole distance that our dressing is going to cover. And then I am going to take, that's the other reason I didn't start over, because I already cracked my chlorhexidine. So I would crack this, and my gloves would be on my hands all the way too. I can't operate my phone with the gloves on though. So crack, and then vigorous scrubbing motion. I'm going to do this out to as much as I need to, and I'm going to be doing this for at least 30 seconds. All about the friction. My patient is very light and likes to move around. 2 to 3 inch area. And then I'm going to allow this to air dry. And this is when I'm going to get my dressing ready. So I'm going to do a bit of skin protectant. I need 2 hands. You're going down for a second. Alright, so I'm getting my skin protectant ready. And this is going to go on, again, my gloves are still on my hands, 2 to 3 inches around where the dressing is going to be. Just so when the dressing needs to be pulled off in the next 7 days or so, I don't accidentally tear somebody's skin off because it's been glued to their skin. So again, 2 to 3 inches around, and I'm going to allow that to air dry as well. And then I am going to apply my dressing. And I'm going to do that in a... I don't want to do that. That's when it stopped recording. All right, you're going down again. Apologies for the poor quality of video. So I'm going to center the window of my dressing. This is not a one-handed job. Over the line. Kind of smoothing it out. Okay, and we'll remove. Aha, there it is. This whole time, I'm making sure that I'm not manhandling this at the bottom. You will forgive my procedure. TJ's Pizza Boxes do not make the best human chest representations. Alright, so that is a dressing change. So now this area is sterile. I shouldn't go about touching all of this area, but sterility is kind of ended now. We're going to go back to clean. So I would take more antimicrobial wipes. I would remove the cap off the end, and I would vigorously clean the lumen with a swab. And then I'm going to take my saline flush, and I am going to vigorously wipe the tip of the saline syringe as well. I'm going to insert it, and in pulsating, I think we called it the push-pull or push-pause, I'm going to do this over about a minute until I get the entire flush out of the syringe. And then during that process, I would have unlocked my tubing, which at the beginning I would have locked, so I did miss that. Wipe vigorously. Oh, then I believe this is when I'm going to be doing a heparin lock as well. So I am going to take another antimicrobial wipe the end of this. I'll have a different syringe. I'm going to wipe the end of that syringe with an antimicrobial wipe, and I'm going to insert the heparin lock, and I'm going to do that same pulsating motion, getting the solution to go in over about a minute and stilling it. So I would have unclamped again, reclamped it, wiped down the cap, recapped, and now if it's indicated, I am going to get the IV set back up. I'm infusing properly, but it's not indicated right now. We were just changing the dressing. We're going to leave this open for now. And then I am going to take my label, and I would label time, date, and initials. I think also the site, and then label the dressing. And that's it.